Well, this morning we're going to have a very interesting talk by Professor Jonathan Todres of the GSU College of Law. Professor Todres is one of the core members of the Urban Health faculty here at Georgia State. 2007?
That's right.
Yeah, he's been here since 2007, and he is a nationally and internationally known expert on child trafficking and the rates of children and the well-being of children. So, Professor Todres, I will turn it over to you for the next hour. You want to cue them as to how you want to take questions?
Sure. This is easy. I will take questions at any time and any question. My plan is to speak for maybe a half hour or so, depending on how many questions there are initially, and then leave plenty of time for discussion. I have a pretty basic PowerPoint just to sort of keep track of sort of where we are in the discussion and some of the points I'm making. But really what I want to do is try and open up as much time for a dialogue, because now I'm hearing that there are geographers and I know there's public health policy people, biology, and so I'm really excited to have an opportunity to have a conversation with such an interdisciplinary group. What I want to do today is four things. I want to give you a quick overview on human trafficking and child trafficking. I don't know how many people are familiar with the issue or with law around it. So quick nutshell description. And then I want to ask the question, are we making progress? A question that I think on a lot of issues does not get asked often enough. And then I'll give you my take on whether we're making progress on this issue, and then offer some thoughts, spend most of my time offering some thoughts on what public health perspectives and urban health perspectives might bring to the table to address this issue. So first, the quick overview. There's a lot of confusion often around distinguishing migration, smuggling, and human trafficking. And so just from a clarification perspective, these traditionally are seen as the elements of human trafficking. You need act, means, and purpose. So act can be one of the things that are listed here. So you can play any part. You are trafficking an individual if you play any part in that sort of process. So if you recruit somebody, if you transport somebody, if you obtain them on the end, at the end sort of destination, it does not. Trafficking definitions have evolved, so it doesn't. To be clear, it's not just about crossing international borders. And today, you can be trafficked here in the city of Atlanta, as many kids are. The means. There has to be some force, fraud, or coercion involved, except when you deal with children. Force, fraud, or coercion is presumed when minors are the victims. And then finally, there has to be some purpose, some form of exploitation. So you're recruited or you're transported for the purpose of exploitation in the sex industry, or exploitation in agriculture, or in sweatshops, in urban centers, or in domestic servitude, restaurants, and hair salons. The list is fairly broad and lengthy. So are there questions on that? So that makes it different from smuggling, right? So smuggling someone across the border, you technically can consent to being smuggled. All sorts of things can still go wrong during that process. But the distinction with trafficking is that it's that you haven't consented to that process. And of course, migration is sort of voluntary movement. The challenge, of course, in many instances in the real world, so to speak, is that many people start out migrating and end up in trafficking settings. So there is a continuum where sometimes you can start out choosing to migrate, and then you end up being, saying yes to a recruitment path that turns out to be a front for human trafficking, and so on and so forth. As I mentioned, there are sort of broadly conceived two types of trafficking: the sort of end exploitation, sex trafficking, and labor trafficking. So I focus primarily on children, so that's child prostitution, child pornography, mail order brides in some cases. And then the labor side is, all the ones that I mentioned earlier. We see a lot in the agricultural sector. We see a lot in textiles, manufacturing. We see it in mining, fisheries, both urban and rural. And then the scale of the problem is an interesting question, and I'll just touch upon it here. The research is all over the place, and this is in some respects, not at all new, right? This is not a new phenomenon. People have been trafficked for centuries. So in that respect, there's nothing new about this. But the focus on it is quite new. Sort of major international and national efforts have been undertaken really since the late 1990s, 2000. So we're talking about a field or sort of a newly sort of formed subfield that's only about 15 years old. And a lot of the early work was not done involving researchers, so we have very little baseline data. And a lot of the early research and the early numbers that came out of work on human trafficking were data that were collected in a way that I think the group of us would realize that there's significant flaws. So some of the early numbers identified that it's 90% sex trafficking. Of course, that was largely based on law enforcement data, and law enforcement at the time was really only looking for sex trafficking cases. So some things that I think you'd readily see that there's some problems with sort of the methodology or limitations is maybe a kinder way of saying it. But so we don't have a good sense of the scale. What we do know, speaking of the United States, is that it happens in urban and rural areas, though most of it tends to be in urban settings. We've seen cases in all 50 states, the US territories, District of Columbia, both sex and labor trafficking. So there's a sense that it's pervasive, but we don't have a sense of the true scale. And we can talk about whether it's worth the energy it would take to come up with a national estimate. So let me talk about this sort of big question, I think, which is in the last 15 years, we've seen major efforts. Are we making any progress? So I started working on this issue in the late 1990s. So it's been about 16 years now that I've been working in a variety of capacities. So I've worked for NGOs, nonprofit organizations that are doing legislative policy work, trying to strengthen laws both in the United States and elsewhere. I've done research for many years, obviously, and a variety of other work on the issue. So when I first started in the late 1990s, there was no national legislation on human trafficking. That first came into place in 2000, the Trafficking Victims Protection Act. That's since been reauthorized 4 times, most recently in 2013. So the Trafficking Victims Protection Act in the United States is sort of the cornerstone that guides our efforts. When I first started, no state had anti-trafficking law. Now all 50 states have passed laws, and most states have amended their laws, including Georgia, since originally adopted it. So this is a really rapid expansion in law and policy on this issue. When I first started, there were very little in the way of services on this issue for survivors. We now see a rapid expansion of survivor-focused interventions. So more shelters are being opened that are especially tailored to trafficking survivors. Hospitals are now sort of paying attention to this issue and developing capacity to identify and respond to suspected trafficking cases. And then on public awareness, I suspect all of you have probably heard stories about human trafficking or seen news stories in the last year or two. When I first started on this issue, and I would tell people that I'm working on trafficking, I'd say about 90% of the people thought I was working on drug trafficking issues, and the remaining 10% would start telling me about their morning commute, thinking somehow I was working on traffic. No joke. I mean, looking back, it seems crazy, but 15 years ago, people were not focused on this issue at all, really. And now, January is recognized by the president as National Human Trafficking Prevention and Awareness Month, and you see stories on a weekly basis. You see movies where now the villain is a trafficker. This is part of a public dialogue on this issue, and I'm happy to talk about whether that's been very effective. So the question, we come back to this question, is that progress? So the easy answer is yes, right? We now have federal law, we have state law, we have services in areas where we didn't have services before. We have shelters, hospitals are paying attention, some select number of schools are paying attention, more people know about the issue. But I think the question, are we making progress, forces us always, whatever the issue is, to return to our goals. And the goal, I think, has to be reducing the prevalence of human trafficking. And so on that question, I think the answer is, at best, I don't know if we've made any progress. As I mentioned earlier, we don't really have reliable baseline data, so that's obviously makes it hard to answer that question. But I think most people working in the field would admit that there's really no evidence that we've reduced the prevalence of human trafficking, despite 15 years of effort, fairly substantial funds. And so I think that raises, for me, the question of why is that? What's wrong with the approach? And I think one thing that we see is that most of the interventions to date are driven by law enforcement and social services. Excuse me. They're aimed at apprehending perpetrators and providing services for victims and survivors. All of that occurs after the harm has been suffered. And so what's interesting to me is that there's actually very little talk about prevention. And it's listed usually. We should prosecute the bad guys, we should provide assistance to victims and survivors, and we should prevent this. But there's very little effort undertaken to actually prevent this in a meaningful way. So I don't want to minimize the importance of aiding survivors or prosecuting, holding people accountable for these acts. They obviously both matter, but I think if the goal is reducing the prevalence of human trafficking, then prevention needs much more attention. And that's where in the last several years, I've been exploring public health methodologies and other methodologies that might be useful. And so I think public health and urban health perspectives shed light on a lot of things that are missing from current efforts and where we need to go. And I don't have time to sort of mention everything that I think might be useful, but let me touch upon 5 things that I think come from public health perspectives. And some of these, particularly for the folks who are in public health, this will seem like public health 101, but I can't emphasize enough that it hasn't been up until very recently, it hasn't really been part of the discussion on human trafficking. So first, evidence-based research. That's, I think everyone in the room knows why evidence-based research matters. As I've mentioned, there's still very little reliable data on human trafficking. Laws and programs continue to be adopted and advanced based largely on anecdotal evidence. That problem isn't exclusive to human trafficking. We know anecdotal evidence is highly persuasive among policymakers, but we see very little systematic investigation and then from that policy flowing. What might change this or on certain parts of the problem is the Institute of Medicine and National Research Council had a study committee, a 2-year study committee that I was fortunate enough to be part of. We published our report, the committee's report, in September of last year. And that, for those of you who are interested, I can send you the link. It's a nice short 400 plus pages. But the good news is if you're interested in the healthcare sector, they're doing shorter sort of sector-specific guides based on the findings of the full report. And there are also specific chapters for each sector in the large report. So there's a health guide, there's a social services guide, and those are much shorter and one might argue more accessible, although I'd like to think the full report is still a good read. But I think that that's the first effort to really assess where are we, what do we really know? And the answer really is we know very little about pathways in and out, risk factors, and things that in the world of public health and urban health that we talk about much more. So that needs to be part of the process, and I think there's an opportunity for researchers, each of you, if you're interested in this topic, to partner with those in the field, because what I hear when I talk to a lot of people doing services for survivors is things like, oh yeah, we have a ton of data. And sometimes they do, but some of it's not very systematically collected. They may be missing opportunities for real insights because they're just less familiar with research methods and questions to ask. So there's some really nice opportunities, I think, going forward for researchers to partner with those in the field and help advance knowledge in this area. So prevention, again, this is something else that I think folks in public health well know. It would make little sense to all of us instead of vaccinating a population, we decided to wait for a major disease outbreak, and then we said, okay, the government said, we'll find out who's accountable, who's responsible for this, and we'll hold them accountable. But that's sort of what we do in human trafficking. Criminal justice and the research in criminal justice, are there any folks here from criminal justice?
I don't think we have.
Okay. So what the criminal justice research tells us is that having a law prohibiting some behavior has some deterrent effect. Ramping up penalties adds very little additional deterrent effect. I mean, what we've seen in revisions to the Trafficking Victims Protection Act in recent years is significant increases in penalties. Now, I think that law also has an expressive function. So if as a society we want to say these are some of the worst crimes, trafficking a child and other related crimes, and so from an expressive standpoint, we want to make that statement. That's important. But I think we should do it knowing that ramping up of penalties isn't going to significantly deter individuals. See, e.g., the war on drugs, right? We've ramped up penalties. We've had aggressive enforcement activities, and that really hasn't significantly changed drug use and other issues around substance use and abuse. So I think prevention needs to be a bigger part of the conversation. I think for those of you who are focused on urban health issues, whatever your perspective, I think you're regularly thinking about prevention on the issues you care about. And I think that perspective really would be valuable in the conversations that I'm having with others about how do we actually prevent this from occurring? What systems need to be in place, or what support do we need for children who are at risk? And I actually think if we can figure it out on trafficking, we'll probably be able to figure out models for a whole host of other issues. So public health approaches, again, they're familiar to you. The Institute of Medicine report focused heavily and relied heavily on the social ecological model and looking at, for those, I think many of you are familiar with it, but looking at the interplay between individual, relationship, community, and societal factors. So what might this look like with sort of, let's say, trafficking of children into prostitution? Obviously, you look at individual risk factors, but then you look at relationships with peer groups, with partners. One of the striking things with interviews with child survivors of trafficking is what they say about changes in their peer groups and how that often spurs sort of a downward spiral. When I've talked to youth groups about this, tragically what I often hear is young people saying to me, oh yeah, we knew something was up with her. We just didn't know who to tell, or we told somebody, but it didn't seem like it went anywhere. So I think children have to be part of that conversation. And so I think there's some real opportunities to sort of look at relationships. Yes?
Are there particular risk factors that have been identified for trafficking of children especially? Yeah,
so we're in the early stages. I mean, I think one of the striking things is that research is really piecemeal. When I mentioned earlier that I think if you can figure out child trafficking, you'll figure out a lot of other harms affecting children because it's a lot of the same risk factors. So we see, one of the things that we see, and they're mostly retrospective studies, is it's family history of child sexual abuse is one of the highest, most common risk factors. Other forms of abuse, poverty plays a role. A lot of the same issues that put people at risk of other harms. And there's a real need still, as I mentioned, to hone that further and get a better sense of what's unique about trafficking. So community settings, schools, what role schools and neighborhoods play, and then of course societal factors. And on the sex trafficking side, that's been a tougher conversation sometimes to have, but we live in a country where a lot of the things that happen in sex trafficking and the harms that occur are really glorified, right? It was less than 10 years ago that a song about pimping won an Oscar. Unfortunately, maybe in a future year we'll see if there are survivors who are willing to come and speak about their experience, and talk to them about the glorification of pimping, and it's. I think you get a very different perspective on what that experience is really about. We live in a culture that continues to sexualize young girls increasingly, and I'm not suggesting that I want to return to the days of the Puritans by any stretch, but I think there's a middle ground where we can be more aware of how that fosters tolerance for some of what's happening. And I think on labor trafficking as well, it's not exclusive to sex trafficking. There's societal factors and cultural norms that should be addressed. So, I think that public health is familiar with this. If you spend any time, I'm sorry John couldn't come this morning, your first speaker, but CDC has been doing work on violence as a public health issue, and a lot of that is relevant to human trafficking, and so I think there's some real opportunities for those of you focused on health issues. All right, the last two pieces. What we found, and this is not new, other people have said this, but in the Institute of Medicine report, is what we really need is a multi-sector response. Children are at risk on a number of levels, and law enforcement interventions or any single sector is not going to successfully address the problem. We need hospitals, we need healthcare, we need schools more involved. We need the private sector involved in a much more systematic way. And I think one of the things that's really important is figuring out, if this is an issue that you care about or you're trying to engage others, figuring out what they're good at. And have them do that. That's true for any sort of social movement, right? You're not asking people to do, the private sector on labor trafficking, for example. Private sector monitors their supply chains in real time. Any big company, ask FedEx where any package is anywhere in the world, they can tell you almost up to the minute. It's actually, on some level, really impressive. So who's better positioned to identify trafficking and exploited labor in their supply chains? Is it FedEx, or is it the labor inspector who comes once, maybe twice a year, sometimes announcing their visit in advance? All right, I think the answer is obvious. Now, tracking packages and tracking human beings, obviously very different, right? But there's an infrastructure there, and I think we have to think about how, what is it that different sectors, whether it's healthcare, the private sector, schools, what is it they care about, and how might they bring, and what are they good at, and figure out how to use their core capabilities to contribute to this problem. I saw a gentleman here, and then a woman back.
Are there any hospital interventions that have been done? You mentioned hospitals.
Right, so we're at the early stages of hospitals. What we've seen is a few hospitals. Emory, there are a few physicians at Emory that are starting to develop training programs so that physicians in emergency departments and other relevant parts of the hospital can better identify potential victims of human trafficking. There are a few other programs. Mass General Hospital is doing a program. There are a couple in California. It's small scale now, and I think we're in the early stages of evaluating whether the trainings that they've done are working, are making a difference in terms of identifying. We know in the sex trafficking context, for example, and true also of labor, that sometimes that's one of the few windows of opportunity, right? Pimps might take boys or girls in their control to an emergency department to get health care if they've been beaten up, if they're the ones who beat them up, because it's sort of protecting their investment, to say it pretty bluntly. So we know that's a window of opportunity, and we're just starting to, healthcare professionals are just starting to have that conversation about, okay, what are we supposed to be looking for? It's really challenging, right? And in some respects, there's a lot to learn from domestic violence and child abuse, and the challenges that healthcare professionals face. We know on those issues, a lot of healthcare professionals have expressed real concerns. I mean, they're mandatory reporters, so the truth is if they identify this abuse, if there's signs of abuse, they have to report that. But we know that a lot of healthcare professionals are nervous about that because they might see an overwhelmed social services system and might be concerned that about where that child ends up, or they might be concerned that if they start flagging this, kids with health needs might not show up at all. So that there's some tensions, and these aren't easy issues to figure out, but there's sort of 20, 30 years of grappling with that issue when it comes to domestic violence and child abuse, and I think there's a lot to learn from those examples. There's a question in the back.
So is there any evaluation as far as on like the primary prevention steps or the tertiary prevention that have been taken? So like recently I've seen different commercials and different kind of publications to kind of spread, I guess, facts and information about sex trafficking, especially like around the Super Bowl and things like that. Like you've seen like this increase. Has there been any evaluation to see if that has any sort of effect, or is that,
So there may have. I haven't checked sort of most recently, but I've seen. I mean, this is one of the striking things when I talk to researchers is they keep coming. There has to be some evaluation of this work, and where we're at is there's very little. So yeah, even around the Super Bowl is an interesting issue because there's been a lot written about how there's often a spike in sex trafficking activity around Super Bowl and other sporting events, and there's some anecdotal evidence of that, but it hasn't been systematically measured. And in fairness, some of this is tough to measure, right? It's really hard to identify those who are at risk or who are being trafficked. On a lot of these questions, I'm not suggesting it's easy. But again, we've also seen research on other issues. Drug users, we have some pretty good evidence now. HIV, there are other issues that are not easy to sort of, that people may be reluctant to disclose or harder to get at, or criminal issues like drug use, where people have done some good research. So I think there's some models out there that can be adapted. But yeah, on that, I haven't seen any evidence-based research evaluating that. So the last piece, and I think that I think is important, again, is the role of survivors in this. And part of this is driven by my work, before I became a lawyer and then and turned to a legal career. I worked in international development and international health for a number of years. And if you do international development work, you shouldn't do anything without spending time with the community that you're going to be working with and where the intervention is targeted. So I think that's, but I think we see a lot of law and policy and work, even programs on human trafficking that spend very little time on that. I think where survivors have often been used, and I think maybe used is the right term, is you'll see them brought out when there's an effort underway. And sometimes it's well-intentioned, but there's an effort underway to raise awareness or to push a particular piece of legislation. And what drives me crazy is sort of how we think about survivors. So you'll hear a congressional hearing or a state legislative hearing when they say, opens with, today we'll hear from 3 experts on human trafficking and a survivor. Why isn't that 4 experts? What we see is survivors have insights, adults and children. I referenced earlier, there's some really interesting work interviewing child survivors of trafficking out of Southeastern Europe. And so from one study, one of the findings, all of the kids reported that they looked to find information at school before they took steps that ultimately led to being trafficked. And they didn't find any relevant information at their school. Many of them reported sort of a significant rupture, change in their life, be either a move, a change in family dynamics and family structure, a change in peer groups. And as we know, particularly if you're interested in child trafficking, a lot of what happens with adolescents happens away from any adult. So not talking to them is just missing a huge piece of what's important to them and what will work. I've seen many examples of proposals that quickly get dismissed by youth once they're brought in. And that's a lot of wasted effort, only to find a group of young people say that'll never work. Kids would never respond to that. So I think there's some opportunity. I think those of you who are sort of interested in working with vulnerable populations, this is also a space where in the human trafficking world we've struggled, or we don't do this very well, engaging vulnerable populations in a participatory way. And so I think there's some opportunity, there's some great research opportunities and important opportunities to partner with survivors and at-risk kids to increase our knowledge about this and maybe inform better policy. All right, the last piece is sort of, so this was a poster that, it's slightly a tangent, but you'll see, occasionally I have a tangent that's a bit of a rant. But so this was a poster that was on my, or it wasn't a poster, it was sort of magazine size. I cut out a magazine and had it on my wall when I was a little kid. And if you can't read it, it says, spot the refugee, there he is, 4th row, second from the left, the one with the mustache. Obvious, really, maybe not. The unsavory character you're looking at is more likely to be your average neighborhood slob with a grubby vest and a weekend stubble on his chin. And this is a campaign by UNHCR trying to sort of confront myths and stereotyping about refugees. And I think I almost started today by asking, and I've done it sometimes in other groups, sort of imagine a trafficking victim and tell me what you think that person looks like. And I think that one of the things that, people talk about, the phrase that people often use is hidden in plain sight. This is happening in our neighborhoods here in Atlanta. This is happening in every other state. And I think one of the challenges is that there are a lot of popular conceptions about human trafficking that don't reflect the breadth of and the reality of what's happening on the ground. And you see this whether it's films about human trafficking, and that, we can talk about, okay, maybe Hollywood isn't the best source of accurate information, but that is what, those popular images is what most people end up absorbing and knowing about human trafficking. And so I think one thing that we can do is also sort of redirect the conversation to reflect who's really vulnerable, and what this experience is really like. So that's my plea, if you will. Spare me 2 minutes. If not, you can just edit it out of the video. All right. I'm happy to continue the conversation, obviously now, but after. That's my contact information. I post some of my human trafficking publications there. If you don't want to copy that down, you just email me and I will send you that same link and you can just click on it. This is a full service operation. So, what questions do you have?
Do you know if there's a difference in the type of trafficking by urban-rural status?
Yeah, so only at a sort of high level. So, so the obvious industries that are rural-based, agriculture, mining, tend, but beyond that, we know sex trafficking tends to cluster in urban centers, but it's not exclusive to urban centers. And there I'm talking about trafficking into prostitution. Child pornography is harder to sort of, there's less known about sort of where that's produced. In fact, a lot of it's produced outside the US. But, we really are, the sort of worrisome thing is how little we know. The exciting thing is how little we know. Because this is a space where there's incredible opportunity to do good work and do good work that a lot of people will pay attention to. Even the thing that we talked about in mandatory reporting, I have a student of mine who's working on an article looking at the complexities of mandatory reporting on this issue for healthcare professionals. I've probably spoken in the last 2 years to at least 20 different medical facilities that are interested in figuring out the mandatory reporting of PCOs. So there's some real opportunities to do research projects in this area that a lot of people will be interested in hearing about. I saw a question around the side.
Yeah, I was a little unclear about what labor trafficking is. Is that like forcing someone to do work, or is it like slavery, or like what is?
Yeah, so it's, again, if you go back to your sort of act, means, purpose, where the labor versus sex trafficking comes in is the purpose, the type of exploitation, and it's exploitation in a labor setting like agriculture, like mining, like the fisheries industry. For those of you who get your hair done into hair salons, that's been sort of hair salons and nail salons is sort of an area where we found trafficking cases. So that's harder in some respects because presumably, if it turns out somebody's recruited and delivered to a labor setting and provided fair pay, good working conditions, and that's not trafficking. It's where it ends up in a labor setting that these circumstances constitute exploitation. So in a labor context, that means whether you're on a farm or you're in a factory, fair wages, who holds your documents, all sorts of questions like that, right? Sort of hours you're working, do you have any breaks? Are you allowed to leave the facility? So I was talking to somebody recently who had worked on a case involving salons doing hair braiding, and the girls just slept in the back. They worked, 16-hour days, and they slept in the back. And they, when this was finally raided, most of them had not been outside for a month. And so that's, I think some of the cases are pretty obvious that this is not just uncomfortable labor, but it's exploitation. Yes, sir. Yes.
What are some of the things that they're doing to try to help mitigate the problem with labor and sex trafficking in Atlanta, like massage parlors? And I've seen that it's a big problem in Atlanta on the news.
So you're right. There are massage parlors that are thriving businesses here in Atlanta. It puzzles me, and maybe this doesn't get posted on the public page, but it puzzles me why they haven't been shut down. Some of them it seems pretty obvious. So I don't know that I can answer that. If we do this again, we should bring law enforcement in and ask them that very question. There's also, Atlanta has a huge sex industry. And I mean that broadly speaking, all, that which is legal and that which is not. And, some of the research is less clear on sort of how the sort of legal sex sector interacts with the illegal activity. But I'm not quite sure why they haven't been shut down. There have been efforts made to try and keep kids out of that environment. This is a great example, where we talked at the beginning about unintended consequences. So Atlanta and other jurisdictions have tried to do things like make it harder for young people to work in, what do we call them, adult entertainment strip clubs. Right, and so what you've seen a number of jurisdictions do is say, okay, so we'll raise the minimum age of working there from 18 to 21. And this is sort of a great example, I think, of sort of a piecemeal approach, right? So if all that does, people who push that effort say, look, now 2,000 young women are out of that unhealthy environment. And there's a good argument that it's if the minimum age is 21, it's harder to be 15 and have a fake ID that successfully suggests you're 21 versus 18. And so we're also keeping underage kids out. The unasked question was, what happens to those 2,000 girls? And so there's anecdotal evidence that a lot of them ended up in worse situations. And Atlanta's not alone in that regard. Other jurisdictions have done the same, and you push people in maybe not particularly desirable jobs, shall we say, but you push unhealthy jobs, but you push them into underground black market jobs that are even more risky. So I think this is where we come back to this idea of a comprehensive response. Like, if you're going to make that effort to sort of prevent kids from working in unhealthy environments or exploitative environments, then that only works successfully if that bill also includes job training, education initiatives that give them that opportunity to transition to something better and not just put them out of a job. But it's a mystery to me why the massage parlors are still open for business here. Guessing back.
How much money is generated from this market? Do you have any kind of figures or numbers?
So there have been numbers bandied about. People talk about this as the second or third third biggest illegal activity. After arms trade and drug trade. There are numbers where people have suggested that a pimp can earn, 150 to 250,000 from a single girl or boy a year. I think that so much of it depends on sort of what are we talking, sort of the space that they're operating in, and so the range you see pretty big ranges. It's a highly lucrative business. In some respects. It also differs dramatically from drugs and guns. You typically don't have the sort of the similar sort of drug kingpin type figures. This is not an easy operation to scale up to that extent. So what you have, and what's challenging on a number of levels, is you have a lot of smaller 1, 2, 3 person, loosely affiliated with other people in other states or groups, as opposed to sort of, there's evidence that some organized crime is involved for sure, but a lot of it's sort of individual operators or 2 individuals, and so that makes it harder to, from a law enforcement perspective. It makes it harder also because now in the U.S., trafficking survivors, there's a mandatory restitution provision for trafficking survivors. So after when the case is prosecuted, they're supposed to be awarded restitution for all that they weren't paid for, and et cetera. There's a study that came out this week that showed only a fraction of them actually are paid, and part of that is a problem with judges knowing about that's mandatory, that they have to order restitution. And some of them are not even ordering it. And then in other cases, they may issue a restitution order for more than $1 million, but by the time, these are small, relatively small operators who operating in cash, and so they have very little in the way of assets, as it turns out. And so that has proven to be, at least thus far, not a very good resource for helping survivors, although I think it's important still. Yes?
Could you talk a little bit about the connection between sex trafficking and internet use now? So a lot of stuff that I've read about it recently talks about, different websites and things like that are kind of making this a lot more accessible.
Yeah, so there's a range of views on this, not surprising. So the idea is that I think most people think that certainly in some ways the internet has made this easier. Originally with Craigslist, now with Backpage.com, that it's just giving people access that they otherwise wouldn't have had. People would not, it also puts this behind closed doors even more than it was before. And so that makes it, in some respects, it makes it harder to root out. It also, in talking to, anecdotally talking to a number of law enforcement officers in different jurisdictions, they find that it's a great resource. Because somehow most people still have not figured out that what you do online stays out there. And so for law enforcement, when they're able to identify cases, or even in investigations, often that can help them build a case. So there is a bit of a good news, bad news, but there's no question that there's some real risks associated with it. There have been efforts to, Craigslist finally took down their, their erotic services section that they used to, or adult, maybe it was called adult, but it was clear once you clicked on any ad what they were selling. Well, less clear is how much of that feeds sort of child prostitution. But Backpage.com continues to post, to provide ads. That turns out to be a substantial amount of their revenue. So I think there are a number of nonprofit organizations that have been pushing Backpage really hard to do something about it. There's some efforts to sue Backpage and see if that can pressure them to sort of close that avenue. I mean, it makes it easier. There's no question. If you go back pre-internet, I don't know if people over here are old enough to remember life before the internet. I was actually alive then. But so the life before the internet, there's really one way to access prostitution, right? You went to areas where there was known to be prostitution activity, and you sort of direct solicitation. There was none of that, and so many people were not willing to do that, either for risk or sort of community shame ideas. This puts it in a private space that makes it much easier, for sure. Yes. On the right, yes.
As far as international trafficking, are there any, measures where you have countries working together as far as identifying hotspots where a lot of the victims are coming from and kind of servicing those areas, so then that way it'll kind of be a preventative measure that you're...
Yeah, so you see selecting them. So there's a lot of international cooperation on this. I think most of the international cooperation on this through the UNODC, what is it, the United Nations Office of Drugs and Drug Control, I can't remember, where there's an international protocol that came out of this and that sort of governs a lot of international law on trafficking. There's a lot of law enforcement, Interpol cooperation on these cases. In terms of getting at root causes and we know these are sort of common migration or trafficking patterns, and these are the places where individuals are coming from. That's largely been left to individual countries. So we know that certain parts of northern Thailand feed into trafficking into Bangkok. And that's, I'm not picking on Thailand there, I could pick any one of 70 countries or so, right? So, but that's largely been left to NGOs and the Thai government to sort of do their sort of development programming and strengthen communities and do economic development there. And then some of that, of course, is USAID and other sort of wealthier nations' development arm contributes to that for sure. But I don't know that it's been in a more systematic way that you suggest. Some of this is hard. I mean, look, the comprehensive approach, easy for me to stand up here and say like that's the better approach, but it's really hard to do all these things simultaneously. There's a good example sort of, but that I think is a good example of both sort of engaging different people and how it ultimately doesn't answer every question. So the UAE had a problem with trafficking of young boys for use as camel jockeys. 3, 4, 5, 6-year-old boys who lived in squalid conditions, were housed in squalid conditions, often got injured falling off a camel and sometimes died, and there's really awful experiences. And And they were trafficked from Sudan and other countries, a few other countries. And so the government finally partnered with the private sector. A Swiss company developed a robot jockey. And there's actually, if you want, I can send you links to where you can see what this looks like. So now you don't need to traffic young 5-year-old boys into this high-risk activity for sport, right? So that's a great way to use private sector innovation, partnering, and alleviating the need to traffic individuals. What it doesn't answer, of course, is what happens to those boys who were, who would have been trafficked? Are there any other opportunities? Do they simply get trafficked or exploited in other ways? And so you're absolutely right. There needs to be more of that sort of community development-based work. And that's why I think, this ultimately, if we can, it's great that there's attention on this issue now, and if we can figure out how to address it, a lot of the development and root causes work that needs to be done on this issue would, I think, serve well on other issues, right? If you're able to keep kids in school and you're able to provide some opportunities for them afterwards, employment opportunities, so there's not this pressure to migrate and pursue riskier options, then I think that wouldn't just address trafficking, but also a lot of other issues.